We switch now to healthcare. Uncertainty tonight after federal health officials slash the number of vaccines they recommend for our kids. Heidi talked to some experts about these changes and what you might want to know about getting your kids vaccinated.
An overhaul to childhood vaccines is now in place. Under the new guidelines, the CDC recommends all children get vaccines for 11 diseases compared to 17. The vaccines no longer broadly recommended include flu, hepatitis A and hepatitis B, meningococcal disease, rotavirus, and RSV.
I am fearful that that will mean then that kids will unduly become ill from illnesses that we know how to protect, and that their family members as well could become ill. All of these vaccines are safe, effective, have been tested for years.
Dr. Gigi Chawla, Chief of General Pediatrics at Children's Minnesota, says those vaccines were added to the immunization schedule for a reason. The CDC says getting those immunizations will be based on shared clinical decision making, meaning families talk to their doctors.
We're going to continue to recommend what we know will be safe and effective.
Dr. Chawla says families need to come in ready to ask their questions and make decisions.
What I want families to really understand is that all vaccines have always been done in a shared decision-making model. It doesn't really change from my standpoint. I'm still going to use the science-based evidence, which has not changed, in order to recommend vaccines. What I do think might happen is the discussions might be very different, and families may feel like, despite some of those discussions, that they don't want to go with the science-based evidence that is presented and may choose to not get vaccinated or to defer vaccines for a while.
The CDC says President Trump requested the agency to look into how peer nations structure childhood vaccinations. These new recommendations more closely resemble Denmark's vaccine schedule, but some critics say it does not take into account the differences between the two countries.
I think that's a real challenge, right? Because I don't live in Denmark. I don't know what the population there experiences for healthcare. What I do know is healthcare in Minnesota. And I know that the risks are high for our patients and families. Even a vaccine as simple as rotavirus, which is now on the list in shared decision making. Oh, my heavens. Rotavirus is an illness that can be really life-altering and cause incredible illness for families.
Senior Health and Human Services officials say the changes are meant to restore trust in public health. But Dr. Chawla worries it could lead to vaccination rates dropping even more.
Some of these illnesses, which I never thought I would see again in my lifetime or my career practicing, have now come back.
The Trump administration says these changes will not affect access to the vaccines or insurance coverage. The Minnesota Commissioner of Health, Dr. Brooke Cunningham, called the changes, quote, highly concerning, and said the confusion and impacts of the decision will take time to sort through. Jana.
Sounds like from that doctor, a lot of individual conversations and parents can make a decision right there that they haven't had in a while.
Yeah, that's correct. That's the best advice. If you are confused, reach out to your doctor and they will help guide you through that.
Heidi, thank you so much. I'll be right back.